Hi, I'm Terry Suresh.
I'm Denise Goddard.
And we are recording a role play interview between a nurse practitioner and a state representative. Hello, Representative Goddard. How are you?
Good morning.
I'm Terry Suresh, and I'm a nurse practitioner, and I'm a DNP student, and I'm in Austin today to talk to you about House Bill 751 written by Zerwas.
Well, good. Well, welcome to Austin. We're always glad to hear from our constituents.
Thank you.
What's on your mind?
Well, this bill, the intent of the bill is to basically save consumers money by allowing a substitution of a lower-priced, generically equivalent medication, not only for brand, like the law currently states, but they're adding in languaging to substitute for biological agents.
Okay. So, as I understand, remember this bill, it's that we're adding just the language for the biologic agents to the existing bill that generics can be substituted for name brand products. Because we all know that my constituents like to save money and they like those generics, which can save about 16% off of the cost of the prescription.
Right.
Okay.
Well, that is correct, and that is very important to our patients as well. But sometimes, depending on the medical need of the patient, the prescriber may feel like the brand or the actual biological agent is more efficacious than the generically substituted medication. And this is really important in medications like seizure medications, hormone medications, some blood thinners, and cardiac medications. It's very important. It becomes more important for the patient to get a better drug than the cost, if that makes sense.
So what happens at the pharmacy if the prescriber doesn't specifically say that brand name is necessary?
Right. Well, in Texas, the pharmacy is supposed to post a sign that states Texas law requires the pharmacist to inform patients if there is a less expensive or generic equivalent available to any drugs. And the pharmacist is required to notify the patient and give the patient choice if it's not specifically stated on the prescription.
Okay. So does a prescriber ever know that a generic was given?
That is the problem, and that's one of the things that this bill actually addresses, is that the pharmacy is required to notify the prescriber within a reasonable time frame that there was a generic substitution for a biological agent.
So what action would you like me to take on this bill?
Well, there's some things in the bill that aren't really quite clear, and primarily is if a provider does not, if it's not clear on the prescription whether generic is okay, we really feel like the provider should be notified and make sure that it's okay. Because it's so important for us to be involved in every step of the patient's care. So that the clarity there would be very, very important.
Okay. So this bill needs to more clearly define in the language when the pharmacy is required to notify the prescriber of a generic substitution.
That is correct.
Okay, all right. Well, I will certainly take that into consideration.
Can I follow up with you in about a month to discuss the status of the bill and if your stance has changed on the bill at all?
Certainly. I look forward to hearing from you.
All right. Thank you for your time.
Thank you.